right. Good afternoon and welcome to the third workshop in our Pride series, Testing Before Sexing. There are some handy tips on how to talk to your partner about getting tested. So I'm going to start with a quote from Dr. Jonathan Merman, who's the director of the National Center for HIV and AIDS. Every time someone gets tested for HIV, we are one step closer to ending the AIDS epidemic. Today, I'm going to chat about the importance of HIV testing, finding out when to get tested, sharing some ideas about how to talk to your partner. And so this will be different types of partners: long-term partners, one-night stand partners, sex buddies. And the whole goal of this is to be safe and to have fun, sexy times. So, HIV and STI testing. The importance of testing is that ignorance is not bliss. Many STIs, including HIV, can be asymptomatic for a long time. So untreated chlamydia or gonorrhea infection, for example, can lead to pelvic inflammatory disease, infertility, swollen testicles, pregnancy complications. We know about HIV and it being untreated leading to immune problems and other opportunistic infections. Syphilis, untreated, can lead to blindness or neurological conditions. And hepatitis C, for example, can lead to liver disease. So the importance of getting tested is to try and avoid that stage of an infection and to get treated. Most STIs can be cured with just a simple treatment. Others, such as herpes or HIV, can be pretty easily controlled with medication. Once you know if you have an infection or not, then you're able to take the appropriate steps to keep both you and your partner safe. The other importance of testing is that we're all human, right? Nobody's perfect. So many of us have had unprotected sex. We've all done things we know that we regret or that we will regret. Asking your partner to get tested or you getting tested is nothing that should be judged. It's part of life. STIs. So get tested and then take steps forward. STIs are incredibly common. And again, we're all human. There are treatments and there are cures. So last year, there were nearly 2 million chlamydia infections in the US, and infections are continuing to rise. And that is just chlamydia. The CDC estimates that there are 20 million new STI infections every year in the US. There's no shame in getting tested or in getting an STI diagnosis. Trying to avoid the stigma about HIV or about STIs can actually result in more infection, and it can result in passing infection on to sexual or needle sharing partners. So just kind of a brief overview of what tests are available and what you can get. There are many different tests available depending on the clinic, the symptoms, your personal history or situation. So deciding where to go and what to do actually kind of takes some research, and choosing where depends on each person. Herpes. So oral and genital herpes are different. However, you can get oral herpes on the genital area, but genital herpes typically seems to stay in the genital area. Accurate testing can only be done during an active outbreak of herpes lesions. HPV, human papillomavirus, and BV, bacterial vaginosis, both require an exam. Both men and women can get HPV. Testing is done with a swab of the cervix, which usually is done following an abnormal Pap test. And at the moment, there aren't actually any FDA-approved HPV tests for those people who don't have cervixes. BV testing is described, as described here, so a swab and microscopic examination. But it can also be detected through other means, which will depend on the provider that you see. Then there's chlamydia and gonorrhea. Those are pretty easy tests, and like we said earlier, it's the most common STIs. Something to keep in mind with these is that you should be tested at any site that you're having sex. So if you're having anal sex, you should get an anal swab. If you're having oral sex, get an oral swab. HIV tests are super fast and they're easy. They can be done with a finger stick or a blood draw, and they're very accurate. Syphilis is a blood draw. The results come back in a few days. Depending on the type of syphilis test that you get, you might have a positive test result, even if you had syphilis once in your life, so it'll come back reactive. That doesn't mean that you have an active infection. However, further testing is recommended to confirm if whatever has come up on this test is new or if it is just the old infection. Then there's hepatitis. There are rapid tests available, and there's relatively new curative treatment that exists. There's also trichomoniasis, which is tested by examining vaginal fluid or urine and then doing further testing if those results are inconclusive. This is not an exhaustive list, and different clinics test for different things. Your individual situation will determine where you go and what tests you get done. Here's some more HIV and STI info. So the results for an HIV test, I said it could be really fast. It could be as fast as 2 minutes. Your test results are always confidential, and I think it's important to know that individuals 12 and over in Illinois can be tested without parental consent. And those results do have to stay confidential. There's no judgment in getting tested. And for someone who's really feeling pressure or anxiety about going to get tested at a facility, HIV tests are available for home use. Syphilis, gonorrhea, chlamydia, and like I said, now hepatitis can be cured. So you can't be cured from something you don't know you have. Testing is pretty accessible. I do want to make a quick note about gonorrhea because there is a super strain going around. It's not very common here in Illinois at the moment, but this super strain is not treatable. HIV and herpes, though they can't be cured, they can be very well controlled with medications. Not knowing your HIV or STI status puts your partners at risk, and it puts you at risk. I'm gonna post a list of testing locations in the description of this video. When to get tested. So consider getting tested in any of these circumstances. When you start sleeping with someone new, when you want to stop using condoms, either you or your partner have symptoms of anything. Think about getting tested if you suspect your partner has been unfaithful or if you're the one who's been unfaithful. People who are having multiple unprotected encounters should get tested regularly. And then also, if someone that you've slept with has an STI diagnosis, that would be a good time to get tested. So you want to think about the time frame of that. So if someone says, oh yeah, I had chlamydia 3 years ago, like that's not an indication for you to go and get tested. But if they got diagnosed with chlamydia a week ago and are still getting treated for it, then you may want to avoid having sex during that time until the treatment is finished, and also get treated yourself. If someone you slept with has a current STI or has HIV, for example, you're going to want to have a further discussion about treatment with HIV in specifically, you want to have a treatment about like viral loads. Is your partner taking their meds? Is the amount of virus in their system really low? Because that puts the other partner at a much, much lower risk of contracting HIV. And then you may want to think about starting PrEP. PrEP, which is the 1 pill once a day prescription that prevents HIV. Chatting with your partner. So, what to remember, it's never too late. Even if you've already been sleeping together or you already stopped using condoms, it's not too late to discuss protection and to discuss testing with your partner. There's no shame in asking. There's no shame with an STI history. Did I not just say that 20 million people in the US per year are diagnosed with an STI? That is a lot of people. Both people in this discussion are sexually active or will be. Sexual activity carries some level of risk, so just because one of you did contract an STI doesn't mean that that person is any more promiscuous than or uncommitted than the other. It's just chance, it's just what happens. It's also important to think about safety. If you feel like your partner might react violently to a discussion about protection or about testing, either try the chat in a public place or don't have the discussion. Receptive partners, so both men and women, may want to consider using internal condoms, which can be inserted up to 8 hours before sexual activity. And it's a way to give people who feel they don't have as much of a voice in the negotiation of condom usage or of sex to still be able to be protected. So, partner history. Different types of partners have different situations and different ease in talking about certain subjects. A long-term partner, for example, you've had time to discuss your feelings. You and your partner kind of maybe you're on the same page about are you sleeping with other people? Have you had STIs in the past? What is your level of comfort with certain sex acts, right? There's a history of communication. It is, however, harder to change behavior. You got a new boo? There might be some more concern about making it awkward. There is the opportunity to talk about past STI or testing history without as much of a history of we've been doing it this way, why are we changing it now? And then a hookup, you might not be as committed to making things work out, so there's more flexibility. Be like, look, if it's not going to be you, it'll be someone else at this bar, okay? It's easier to introduce testing at the beginning. So you can make your desires clear from the get-go, right? On Grindr or at the bar, you can say, look, this is what I need in order for us to get busy. If you're not about it, I'm going to move on to the next person. Negotiating testing with each of these types of partners has its pros and its cons. But there is a way to bring up the issue in each of these situations. And I think how you approach it depends on you and your partner, as well as your personal history. Here are some more concrete approaches. You can start with, hey, look, I'm just gonna need us to wear condoms till we both get tested. Or we're keeping each other safe by getting tested. You can use humor, or you can be serious. You can use logic or be fun. It all depends on the situation. It's important to, or it can be helpful to call out awkwardness. That can actually make the situation more comfortable. So I know it's totally awkward, but I want to ask if blah, blah, blah. And then it opens up discussion too. Start early. That's about trying to introduce the subject as early as possible in the course of a relationship or of sexual activity. We are keeping each other safe by getting tested is a way to be like, look, I'm not accusing you of anything. I don't want you to think that that I'm doing that, or to be like, oh, well, you must have something. We're keeping each other safe. I don't know you, you don't know me. And just straight up ask, you ever been tested before? What have you been tested before? It's an interesting point about saying, I've had unprotected sex before, because what is that doing? It's reducing the judgment on if you're having unprotected sex now or if you're getting tested now. Like, look, I've had unprotected sex before. It made me worried for the next 2 weeks until maybe I was going to get a symptom or until I got tested. I don't want to do that again. Or the same with, I had an STI last year and like that burnt, and I do not want to have that happen again. So that can help with the judgment piece too. Don't apologize. Don't apologize for disclosing STI history or for asking for testing before sex or for demanding condom use. If you are sharing a current STI diagnosis, say HIV or herpes or HPV, be sure to be armed with some information to help put your partner at ease. So if you're disclosing an HIV status, talking about, but look, I'm on treatment, my viral load is undetectable, just that alone makes it impossible for me to transmit HIV to you. If you're still worried, there's PrEP for HIV prevention that you can be on as well. Let's see. I mean, like, let's have a date night at the clinic. It's something I used to joke about at another clinic where I worked. But it's certainly something that couples can do. They can get tested together. And then you can just be straightforward with it. Hey, when do you want to get tested? There's also other things like I get freakier when I feel safer. Things that can encourage the discussion and possibly, hopefully, encourage people to want to get tested more. And then there's also risk reduction. So if you don't know your status, I'd prefer if you come on my back instead of inside, or I'd rather we masturbate with each other instead of having insertive sex. Again, I'm going to bring up safety. Always keep your safety in mind when discussing these issues. And if you're afraid your partner may become violent, choose a different time or place. I'm going to put the National DV hotline in the video description as well. So know yourself. You got to know your limits. Know what you are and aren't willing to do with and without protection, with and without a test, with and without monogamy. I'm going to talk about that in a minute. Just another brief thing about partner history. I just want to reiterate, it's never too late. Even if you've already been sleeping together or just started using condoms, it's not too late. All of those approaches that we just showed can be helpful regardless of how long you've been seeing your partner. But there are some differences in how to talk about getting tested, depending on how well you know your partner and depending on you. And your means of communication. How do you normally communicate? If you are direct, it could be really easy. Hey, look, I want us to get tested. If you prefer a softer approach, or if you get more anxiety talking about more sensitive topics, then some of these different approaches might be more appropriate. So take the time to examine it. Just remember that acknowledging awkwardness can help. And apart from that, think about your approach and your plan ahead of time. Maybe write something out. Maybe when you're there, you throw condoms up in the air, so then you don't have to say, I need you to use a condom. It can be kind of lighter. Or you can show documentation of your last STI test. There are ways of bringing up this subject without having to use words, which can be difficult for some people. And finally, know yourself. I want to spend some time here on the backbone of how to talk with your partner. None of these tips that we've talked about will be helpful if you don't know what you want and what you are or are not willing to negotiate. These are questions that can be asked before someone enters a relationship, in the middle of a relationship, when someone's not sexually active at all. In general, it's important in life for you to know your boundaries. In terms of sexual activity, you want to think about some of these questions and know where you stand, right? So is it testing or nothing? So either we're going to get tested together or we're going to sit on the couch and not touch each other. Or are you willing to have protected sex if your partner won't get tested? Do you have to actually see the results with your own eyes, or do you trust if your partner says, yeah, I got tested, this is what my results were? Will you engage in other sexual activity before testing? How frequently will you two get tested, or you three, or however many? Are you monogamous? Is your partner monogamous? Have you talked about it? And then PrEP. Do you need to be on PrEP, or does your partner need to be on PrEP for HIV prevention? There are things that, discussions that may change depending on your situation and your partner's personal situations and needs. So in the end, we're looking for satisfaction, fun, pleasure, companionship, and sometimes children. And we want to be able to do it in a way which makes us feel safest and most secure. The point is to have fun, and to take all those other worries away. And once you do that, it's much easier to have fun. Here are some of the sources that I used for this presentation. Thank you for your time. I'll post some resources in the video description.